Such are these things, once of science fiction, but now reality. Using the body's own cells to heal itself is a cornerstone of modern medicine. At Maj Medical Clinic, we're equipped to provide these treatments to our patients to speed recovery and produce exceptional results.
I'm Dr. Majzoubi. I want to share with you some of the regenerative treatments that I offer patients for chronic conditions, such as chronic back pain, joint pain, injuries to the shoulders or knees, as well as autoimmune conditions such as rheumatoid arthritis, lupus, psoriatic arthritis, and dementia. These are all chronic conditions that there are really no real treatments for other than perhaps surgery, and sometimes that doesn't work. I harvest the stem cells from their own body, usually around the fat cells, and we inject that either into the tissues or in the IV. We've had great results with stem cell therapy here at Maj Medical Clinic. I have patients that come from all over California. I've treated over 400 patients with various conditions. My patients have shared their stories and the great results that they've gotten from the stem cell therapy with KC24. Let's see what they have to say.
So 9 years ago, I got valley fever, but I was misdiagnosed with bacterial pneumonia and given an antibiotic that I had a really bad reaction to. And I had a lot of complications from that, including peripheral neuropathy, central nervous system neuropathy, autonomic nervous system neuropathy, ruptured tendons, tinnitus, just a long list of bad things from this drug.
Maj Medical Clinic specializes in stem cell and cellular therapy, processes that inject the patient's own stem cells into the affected area. This non-invasive regenerative treatment replenishes depleted tissue and cells, expediting the time it takes your body to recover and heal itself.
9 years of suffering from that drug because nothing helped. So I did a lot of research and it kept coming up with stem cells, so I started doing a lot of research with stem cells. And then I found Dr. Maj's flyer and I called him and we talked and we did the procedure at that point. I felt better the next day. I had had a limp on my left side for over a year, and the next morning I got up out of bed, made coffee, wandered around the house for 20 minutes, and all of a sudden I realized that I wasn't limping. I had 0 amounts of pain in any part of my body, which was basically riddled with pain the day before. So it was a miracle, honestly.
Here with more on what exactly that is Dr. Majzoubi of Maj Medical Clinic in Visalia and his patient, Elizabeth Valdivia. And I know you have a great story to tell, Elizabeth, but I'm going to start with Dr. Maj. How does stem cell therapy help tendon injuries, doctor?
So stem cell treatment includes platelets and stem cells. The platelets provide the growth factors, and the stem cells, it stimulates the stem cells to produce and regenerate the tissue, the injured tissue that's around it. So when we inject the stem cells with the platelets, with the fat cells, which provide the scaffold for the stem cells to work on, it begins to regenerate the tissue.
And that's coming from your own body.
Correct, correct.
Right. Wow, so it's the body healing itself, basically.
Right.
Tell me your story, Elizabeth. What was your pain like and when it happened?
I was in a car accident in 2014, and I had this real sharp pain, like a piercing pain, for about 6 months. And I said, oh, I got to go see the doctor. So I went to see Dr. Majzoubi, and he had me take an MRI. And then after that, the MRI came back that I had a tear, and he recommended the stem cell. I was a little nervous, but I'm so happy I went through it. I didn't have any pain medication during the surgery. And it was a little sore after like 2 or 3 weeks, but after that, it was so, I mean, I don't have any problems. I'm so happy about that I went through with it.
That's amazing, because, you know, a lot of people get into some sort of accident, car related or whatnot, and their neck and then they go directly to doctors that can give them medication. Talk to us about, because we have pictures also of how the tendon looks before and then after.
Sure. Just on her case, she did take medications, and she actually got a cortisone injection that didn't really work. And then after that is when we decided that this should be the thing that we should do, and it really helped her. So here's a picture of a tendon just like hers. and you see a hole in the middle. That's the partial tear. And in the next picture, this is 2 months after the treatment. As you can see, that hole is being filled, and the tendon is being regenerated with new stem cells and cartilage cells. And then this was a basketball player that actually started playing basketball 6 months after the treatment. Wow. And here's a picture 1 year later, and you see that the tendon is completely healed.
But so how long does it take for them to feel better, for a patient to not feel the pain? I mean, it seems amazing that from one day to the next.
No,
Is that what happened?
About 2 or 3 weeks, I had no pain. I was like, I had even forgot. I was like, oh my God, I don't have that piercing pain anymore.
Wow, is that common for a lot of your patients?
Yeah, so initially when we do it, because of the fact that it causes some inflammation, they actually have a little more pain for the first couple of weeks. And then after that, probably by the 3rd week, they start to feel better. And they turn the corner. And usually anywhere from 3 weeks to 8 weeks after is when they really start to feel that there's having less and less pain.
I'm happy.
What do you say, Elizabeth, to people that think that this can't, I mean, how can this possibly
Well, I
work?
kind of thought that. I was like scared, like I never heard of that.
Yeah.
I'm like, oh, I don't know. I'm so happy I went through it. I trusted him. I felt comfortable with him. I didn't even have pain medication during the surgery. It was great.
Wow.
Afterwards, I'm so happy. Like I can do anything with my shoulder.
You're kidding. And so this is her shoulder, but do you also do other tears like on knees? And I mean,
Sure.
other...
So we do patients that have ligamental tears, as long as they're not full tears, they're partial tears, because the tear has to be close together in order for the regeneration to occur. We do, tears in the, I have patients that have had Achilles tendon tears that we've injected, just like the picture that we saw.
Yeah. And how do you get the stem cells?
The stem cells are harvested from the fat around the belly here.
Okay.
And it's they're around the blood vessels around the fat cells, and they're called the stromal vascular cells. And there's a group of stem cells that are there. They're precursor stem cells. And these stem cells turn into cartilage, bone, muscle, tendons. Wow. And so the platelets actually help them regenerate and stimulate the cells.
Stem cells are the body's raw materials, cells from which all other cells with specialized functions are generated. Done here in the comfort of the office, using local anesthetics, Dr. Majzoubi gently removes about 6 to 8 tablespoons of fat from either side of the patient's belly, and then, through a series of steps, isolates the stromal vascular cells that contain the stem cells. Once washed and purified, the number of viable cells are verified by a cell counter, and the stem cells are then ready to be injected. Simultaneously, blood is drawn from the patient and its platelets isolated, which are then used to activate the stem cells and speed up regeneration. The function of platelets and resident stem cells in our body is to activate resident stem cells to regenerate tissues, such as in a cut. But here we are bringing those two cells together to produce a more robust regenerative effect.
Joining us now, we have Dr. Daria Majzoubi of Maj Medical Clinic, along with one of his patients, Rondi Paquette. Hi, guys. Welcome.
Hi. Good to be here. Thank you.
Thanks for being here. So, stem cell treatment, it's not something new, but let's tell people what it's about.
Yeah, stem cells are cells that can turn into any other cells in the body. And we have lots of those stem cells in our fatty tissue. They're called mesenchymal stem cells. And they're the really true regenerative cells in the body. So what I do is I harvest the stem cells from the fat cells. I separate them, I isolate them, and then I have a cell counter that tells me how many live cells I have. And then we re-inject those either in joints that are damaged, or we give it to them IV. In the case of Randy, he had both shoulders. Well, you go ahead and.
Well, I was told by my orthopedic doctor that I go to that I needed both shoulders with artificial implants put in.
Oh.
That didn't sound too attractive to me, and I said, you know, I can still reach up here with a little pain, but not much. And I think I'll live with it for a while. So I went home and started researching, have some friends that go to Dr. Maj, and went and met him and did a little, I don't know, assessment, and my wife and I decided to go ahead with the stem cell injections, and I'll be real honest with you, I would do it 10 times over surgery. And I've had a lot of surgeries previous to this treatment, but it was, the results have been fantastic. My wife and I are both thrilled. It was, I don't have any pain anymore, and I'm a competitive water skier, and I'm still competing. And I thought that was going to end with shoulder implants, but it's not. And so my goal next year, I'll be 70, and my goal is to go to barefoot national championships. So
wow,
I have a chance at it now. Yeah, there's a little bit of footage there.
So this is actually 3 months after we did the procedure. Randy was not able to do this prior to this, and it took about 3 months, and now he's back in the water, and he's going to compete professionally next year.
Wow.
Again, yeah, back in the professional ranks.
Good
so
for you.
It'll be fun.
So how did he convince you?
He didn't convince me. I just knew that I was going to have to do something eventually. I'm going to say, it's a guess, but I'm going to say 8 years ago I had this shoulder surgically repaired. It only lasted about 5 years. And it was a positive result also, but it was, I don't know how many thousands of dollars because I had good insurance, but it was a lot of money. And a lot of rehab and a lot of aftercare and physical therapy. With the stem cell, Dr. Maj did the injections, and he says, don't do anything for a couple of months. And that's difficult because my wife and I own a decent amount of property, and it was difficult to not do anything. That was the hardest discipline I had to do. But it's just waiting for the stem cells to regenerate the tendons and ligaments. And then he said I could ski, so I started skiing easily for about a month, and I took it easy. And then he and his son came out, and we skied together.
That's great.
And then he said, looks like you're ready to go. So I started skiing more aggressively and more and more and more. And actually, I'm skiing better now than I was 15 years ago.
Wow.
Now, also talk about your arthritis and the pain after the treatment.
Well, I was a good donor according to his staff and him. And so I got some IV stem cells also because I had a lot left over after he did my shoulders. So I had no expectations, but he told me that they have that ability to find where they need to go and whatnot. So I opted to take the IV. And with the IV, like I say, I had no expectations, but I'm 70 years old almost, and I have a lot of arthritic pain from previous surgeries and age and whatnot. In 3 days, I could notice a difference in my energy level. My arthritic pain was almost completely gone. It still is to this day. And my blood pressure was lower. Not that it was super high, but it was on the high level, and now it's perfect. And I don't come from a good history genetically for that, so it was wonderful news. I mean, I had a lot of side benefits that I wasn't expecting.
That is good news.
Yeah, it was great.
There are a wide number of afflictions and ailments that can benefit from stem cell therapy, including hair loss, tendon tears, COPD, fibromyalgia, diabetes, neuropathy, asthma, issues with the knees and walking, and autoimmune diseases such as lupus and rheumatoid arthritis. Because some of these stem cells can also cross the blood-brain barrier, IV stem cell therapy has been shown to be effective in not only treating and improving dementia, it's been effective in treating autism in children. Stem cells are also effective in regenerating hair by stimulating the hair follicles to go into their growth phase and produce fuller and thicker looking hair.
Today, we meet a young businesswoman who started to notice her hair was falling out and sought the help of Dr. Daria Majzoubi of Maj Medical Clinic in Visalia. I talked with Dr. Maj about his hair rejuvenation treatment, where he uses the body's own stem cells to regrow the hair. For 39-year-old Amy Rose, it was life-changing.
When you're a young girl and you start to lose your hair, you don't want to talk about it. And you don't want people to judge you about it. And now that I've had this done and I've gone through what I've gone through, I specifically tell people about it. I'm like, check this out. Look at my pictures. Look at my before pictures. Check them out, you know, because there is life after death.
Tell me about Amy. When she came into your office, she was just at a loss. She didn't know what to do.
Yeah, so Amy came in, and for her age, she had very thinning hair.
She was young, right?
Yes.
Yeah.
Yes.
Yeah.
She's in her 30s.
In her 30s. Mm-hmm.
Yeah. And so she told me that she's been losing her hair for the past few years, and it looked pretty thin. So we talked about the different treatments, and then we started the treatment on her. And she responded really quickly, actually. Some patients respond quicker than others. If you've had hair loss for a long time, usually it's a slower start, but everybody does respond. It's just that some people need more treatments and some people need less.
Tell me about this procedure that you have.
So it's a PRP treatment in combination with stem cell treatments.
What's PRP?
So PRP is platelet-rich plasma. Mm-hmm. So we draw the patient's blood, and we concentrate the platelets, usually about 5 to 6-fold from what's found in the blood. So the platelets have all the growth factors, and it stimulates the resident stem cells within the hair follicle to grow. So a lot of these hair follicles are in the dormant stage that aren't in their growth phase. So what we do is we give platelet injections to kind of kickstart them into the growth phase.
Mm-hmm. What do you think accounts to hair loss? What causes it?
So usually stress causes it. Also, there's a dihydrotestosterone that the DHT that the body produces, and there are receptors at the bottom of the hair follicle, especially in the crown area, that has those receptors, and it decreases the circulation to those hair follicles, and the hair follicles get smaller, and you lose your hair.
Do all of those products that claim hair growth work?
Not all of them.
Yeah.
I think that sometimes they just prey on people's desperation.
I mean, I was trying, you know, hair growth pills. I was trying, yeah, I mean, everything. Trying to sleep more, de-stress.
And once it starts to grow, then they have to keep the hair cycle in its growth phase. So they have to come in maybe every 6 months or every year to get just a retreatment. But for the people that it does work on, it's amazing.
How long are the treatments, and how much time before someone notices a difference in their hair?
So usually it takes about anywhere between 3 to 6 months to see a difference from each treatment. Now, not all PRPs are the same. There are other doctors that do PRPs. They don't use a high concentration system. I use a very high concentration system, and I've been doing it for about 4 years now, so we've really perfected the system. We do PRP with microneedling, and then we do stem cells, and it's all about how you inject and how deep you go into the tissue when you do the microneedling.
We really just started to see just hair growth. I mean, it was really amazing, like where, especially my temples, like right here, like this was just completely, pretty much bald. Yeah. And now it has like little baby hairs all over. It's almost like when I touch it, it's similar to how I felt like when I was a kid.
What's the recovery time? And for those people that are watching are probably thinking, is it painful? Is it not painful? Tell us what to expect.
So the procedure is not painful. I initially do a nerve block, so we block the nerve that goes into the scalp, and once I start injecting, there's usually no pain. The recovery time, the next day they could go to work.
Wow. I thought, who is this guy? Like, this guy, is this probably like a witch doctor type of thing, or what is he all about? And when I met him, you know, his heart and his kindness and how nice he was to listen to me. He's just a very touching man, yeah. When you look at yourself in the mirror, you're thinking to yourself, like, wow, okay, like, this is what I'm just gonna have to deal with forever. And then, you know, you go out on a limb and you trust something and it works out.
Well, it sounds pretty life-changing, and it's proven to be life-changing for Amy, so you're doing great things here as usual.
Infusion of adult stem cells can modulate the immune system, lead to a reduction in inflammation, and promote tissue repair and regeneration, contributing to the healing of damaged organs and tissues affected by these diseases. If you're interested in learning more about how the body can be its own solution to cellular regeneration, Just ask Maj Medical Clinic. We'll be happy to sit down with you to explain the many benefits of stem cell treatments and cellular therapy right here at Maj Medical Clinic.